Assalamu alaikum. This is Dr. Sana. As the students of dental profession, you will be concentrating your studies on the head and neck, and more specifically on the structures that make up the oral cavity. It is imperative that you are extremely familiar with the normal makeup and structural component of this area. Therefore, this chapter has been set forth to serve as an introduction to your studies of the head and neck region. This chapter has been taken from your first module, point number 91, 92, and 93. The objectives of this presentation are to describe the boundaries and sub-boundaries of the oral cavity and the structures in each area, to define the term vestibule, oral cavity proper, mucobucal fold, frenum, alveolar mucosa, gingiva, exostosis, Torus palatinus, and Torus mandibularis. Exostosis, Torus palatinus, and Torus mandibularis are the abnormal structures or the abnormalities in these structures, which will be defined. To define the landmark in the floor of the mouth and the hard and soft palate and the structures that form them. And lastly, to be able to tell the normal from the abnormal in the oral cavity and to ensure a follow-up examination. So basically, it's the core knowledge of your oral biology. References in this presentation are taken from the internet, your pocket dictionary, the Medscape, and some references from the internet, and 10 Kates, Urbans. The oral cavity consists of two portions, the vestibule and the oral cavity proper. The vestibule is the cleft between the lips and cheek externally and the gum and teeth internally. The oral cavity proper is bounded by the alveolar arches, teeth and gum, and palate and tongue. We'll be explaining them further. This diagram shows the hard palate, vestibule, tongue which is in the floor of the mouth, the hard palate making the roof of the mouth, and this all makes up the oral cavity proper, with the soft palate at the back of the roof of the mouth. The first definition, as we will be discussing, is the vestibule in the oral cavity. But first we'll explain what is oral cavity proper. The mouth cavity proper, called the cavum oris proprium, is bounded laterally and in front by the alveolar arches with their contained teeth behind. It communicates with the pharynx by a constricted aperture termed the isthmus faucium. The mouth cavity proper, which is the cavum oris proprium, is bounded laterally and in front by the alveolar arches with their contained teeth behind. It communicates with the pharynx by a constricted aperture termed the isthmus faucium. It is roofed in by the hard and soft palates, while the greater part of the floor is formed by the tongue. So the tongue occupies most of the floor of the mouth. The remainder by the reflection of the mucous membrane, which is the reddish part of the or the muscular part of the face or mouth. From the side and under surface of the tongue to the gum lining, the inner aspect of the mandible, it receives the secretion from the submaxillary and sublingual salivary glands. Salivary glands are secretory apparatuses of the floor of the mouth. There are 3 in number, the major ones, and there are minor salivary glands as well. What is oral cavity? The human oral cavity refers to the mouth and all its parts, including the lip, tongue, teeth, and the roof and floor of the mouth. Primarily belonging to the digestive system, the oral cavity also plays an important role in respiration. As you can see in the diagram, the upper lip can be seen prominently, the lower lip can be seen, and whole of the apparatus makes up the oral cavity. The gums are the reddish portion or the main portion of the mouth or the arches. Then we can see the hard palate, which makes up the roof of the mouth. Then there is a soft palate, which proceeds after the hard palate, and it is the soft part and non-bony part or the muscular part. Then we have the buccal mucosa, which makes up the posterior part of the mouth and the inner surfaces of cheek lining, and the inferior labial frenulum, and the upper frenulum, which is the superior labial frenulum. We'll be defining them later on. Then we have the lower lip, And the superior labial frenum is then preceded by the uvula, which is the hanging portion or the muscular hanging portion of the soft palate, and which can be seen prominently when the mouth is open. Then we have the tongue, which makes up the floor, which makes up most of the floor of the mouth. Then we have the lingual frenulum, which is a connective tissue apparatus again. Then we have the teeth making or covering up the arches, the submandibular duct opening into the lower mouth or the behind the lingual frenulum. Now coming upon the structures, this is the nasal cavity. Below the nasal cavity, the roof of the mouth starts, and which is formed by the palate. In front or interior portion is occupied by the hard palate, while the posterior part is formed by the soft palate. Then the lower or the floor of the mouth is formed by the tongue. The jaws and lips makes up the interior part. The jaws proceeds backward from the front to the back, and this is the oral cavity proper. Then going towards the neck or down upon the neck is the pharynx, then the epiglottis, and the larynx opening into the pharynx. The epiglottis is again fleshy part, helping the airway to block when we are digesting, or the digestive ways to block when we are breathing. Then we have the esophagus and the larynx, which is the vocal part of the neck. This is the head and neck structure. Below is the photograph of a human open mouth, where you can see the uvula, the hanging portion, very clearly, and the rest of the structure of the oral cavity proper. And we can see the vestibules, which is the first defined term, the vestibule. We'll be discussing it later. Okay, now this is again the oral cavity structure. You can see the frenulum in the in the mandibular part. This is the lingual frenulum. As we can see it in the lingual part, lingual means the tongue part or below the tongue. Lingula is a term again for the tongue, the medical term for the tongue. And the sublingual folds can be seen. Okay, now we have again we are defining it. The mouth consists of two regions, the vestibule and the oral cavity proper. The vestibule is the area between the teeth, lip and cheek. The oral cavity is bounded at the side and in front by the alveolar process containing the teeth. The mouth consists of two regions, the vestibule and the oral cavity proper. I'll be explaining them again and again so that your knowledge is enhanced. The vestibule is the area between the teeth, lip and cheek. The oral cavity is bounded at the side and in front by the alveolar processes containing the teeth. The ridge over which the teeth are formed is known as the alveolar process, and at the back by the isthmus of fauces. Its roof is formed by the hard palate at the front and a soft palate at the back. The uvula projects downward from the middle of the soft palate at its back. The floor is formed by the mylohyoid muscles and is occupied mainly by the tongue. The mucous membrane, the oral mucosa, lines the sides and undersurface of the tongue to the gum, lining the inner aspect of the jaw, the mandible. The mandible or the lower jaw. It receives the secretions from the submandibular and sublingual salivary glands. Again, two parts of the oral cavity can be seen. The oral cavity is again divided into two parts, the oral vestibule, defining it in or explaining it again. The first part of the oral cavity, the vestibule, is the opening with the oral fissure. It is bounded by the lip and mucous lining of the cheek in front and the teeth, gum and alveolar processes. The thick bony region containing the tooth sockets is the alveolar process in the back. It also includes the fleshy mobile part of the tongue. The fleshy and muscular upper and lower lips are connected with each other by the labial commissure or the corner of the lips, while fleshy folds of the mucous membrane, superior and inferior labial frenum, connects the upper and lower lips with the gums. The reddish or pinkish mucus covers the connective tissues surrounding and supporting the teeth. The enamel covering of the teeth is the hardest structure in the human tooth or human body, as explained by the picture. This is the oral cavity proper. The vestibule. The vestibule is the area in consideration. You should begin by examining the lips. The lips are the junction between the skin of the face, and which is a dry tissue, and the mucosa, which is the wet tissue. So the lips are the junctional point or the zone, vermilion zone, between the skin, which is the dry tissue, and between the opening of the mouth, which is formed by the mucous membrane, which is moist tissue. Between these two areas lies a transition zone or the reddish zone known as the vermilion zone of the lip. If it is along the border between the skin and the vermilion zone that one commonly encounters cold sores, which are generally caused by herpes virus. This is the commissure or the corner of the lips. The skin of the upper lip has an indentation at the midline known as the philtrum, and which is derived from the embryonic medial nasal processes. This is the philtrum part of the lip. The philtrum, the ditch, and it is at the lateral junction of the philtrum that a cleft might be formed. Cleft is an discontinuity between the forming structures. The oral cavity proper again. The posterior part of the oral cavity referred to as the mouth proper. It is bounded by the hard palate in the upper front, while the soft palate constitutes the upper back boundary. Inferiorly, it has various oral muscles, glands, tongue, attachment to the oral cavity floor through the flexible bands of tissues known as the lingual frenum, which are the connective tissue bands. The oral cavity proper is also surrounded by the mucous membrane continuing from the vestibular wall. A fleshy protrusion, the uvula, which is the hanging portion, is located at the back of the soft palate, moving along with it to keep food from entering the nasal cavity. Anatomy of the oral cavity. Anatomy of the oral cavity can be seen from the diagram. Again, the oral cavity proper. This is the oropharynx or the oropharyngeal part. The nasal cavity makes up the roof of the mouth, or it is above the roof of the mouth. Then we can see the soft palate in the maroon part, and in front, behind the lip area, is the hard palate. The oral vestibule makes the opening towards opening, or it is the pathways on the side of the alveolar processes and the cheek. The lip can be seen, teeth are there, and the tongue makes up the floor of the mouth. The uvula is again the hanging portion in the maroonish part from the soft palate. Then we have the salivary glands, which is again an important part of the anatomy. There are three major paired salivary glands: the parotid, submandibular, which are also known as the submaxillary, and the sublingual glands, and other minor salivary glands. The vestibule area receives the secretion from the parotid gland, the vestibule. I'll be explaining it again, while the submandibular and sublingual glands open into the oral cavity proper. Now, defining the landmarks in the mouth. The oral cavity. The oral cavity is the upper end and the beginning of the digestive system, and its posterior end forms a common pathway with the respiratory system. The oral cavity begins at the lip and cheek and extends posteriorly to the area of the palatine tonsil, which are usually referred to as the tonsils. These lie on the sides of the throat between the two folds of the tissues, one in front and one in the back, called the tonsillar pillars. Posterior to the tonsillar pillars, the oral cavity ends and the oropharynx begin. A pathway shared by the digestive and respiratory system begins. In this area, from the oropharynx to the laryngeal pharynx, the digestive system continues to share a common pathway with the respiratory system and then goes on to the esophagus to the digestive system. The respiratory system starts at the nasal cavity and includes the nasal pharynx, oropharynx, and laryngeal pharynx, and then continues on into the larynx, trachea, bronchi, and lungs through the throat. The oral cavity can be logically divided into two parts, the vestibule and the oral cavity proper. The vestibule is the space or potential space that exists between the lip or cheek and the teeth. In an edentulous person, edentulous means without teeth, it would extend between the lip or cheek and the alveolar ridge bearing the teeth, where the teeth were at one time or will be if it is an infant. Additionally, the oral cavity proper is the area surrounded by the teeth or alveolar ridge back to the area of the palatine tonsil. This includes the region from the floor of the mouth upward to the hard and soft palates. The anterior and posterior borders also demarcates the landmarks of the mouth. By elevating the mandible so that the teeth are in contact and then retracting the lips and cheeks, you can see the vestibule. It is bounded anteriorly by the lips, labia, and laterally by the cheek, bucca. A finger placed in the posterior portion of the vestibule will be impeded by two obstacles: the bony anterior border of the ramus of the mandible and the soft tissue. The cheek is formed to a great extent by the buccinator muscle, covered with the skin on the outside and a moist mucous membrane on the inside. This muscle extends back from the corners of the mouth to join with the muscles of the upper throat wall. As it passes backward, it crosses in front of the mandibular ramus from the lateral position to a medial position, limiting the posterior extent of the vestibule. As you run your finger in the upper posterior vestibular space, you can feel the ridge of bone that is the beginning of the anterior part of the zygomatic arch. The zygomatic arch makes the cheekbone. This is often referred to as the zygomatico-alveolar crest. Run your finger along the cheek area of the vestibule and note the landmarks and structures just mentioned. Now the superior and inferior borders. The point at which the mucosa of the lips or cheeks turns to go towards the gingival or gum tissue is known as the mucobucal fold, which is the second definition, most important. So it comes in the superior and inferior borders, that it is the point at which the mucosa means the muscles of the lips or cheeks, turn to go towards the gingival or gum tissues, is known as the mucobucal fold. The mucobucal fold. The mucosa lying against the alveolar bone is loosely attached and movable and is known as the alveolar mucosa. So it is the mucogingival junction. It is the alveolar mucosa, which is the reddish portion above the gum level, and it shows the pallor, or the yellowish portion shows the attached gingiva. It is attached to the bone, therefore the blood supply is less as compared to the alveolar mucosa or the loose alveolar mucosa. And then we have the interdental gingiva. The interdental gingiva is the gum portion between the two teeth, making up a V kind of structure. And then coming towards the middle portion, which makes up the labial frenum or the maxillary labial frenum. It is the maxillary labial frenum. Then we have the marginal gingiva. Margins mean it makes up the margin between the tooth and the gum. And then we have the maxillary vestibule. This is the maxilla. Maxilla is the upper jaw, and the vestibule making it is called the maxillary vestibule. And then in the mandible we have which is the lower jaw, we have mandibular vestibule, and this is the mandibular buccal frenum. These we have mandibular buccal frenum as well in the mandibular arch. The maxillary labial frenum is the prominent structure or the prominent connective tissue, and it can be seen clearly when the mouth is open. So the alveolar mucosa, as I've shown, is a movable part and the reddish part. This mucosa is generally reddish because of the presence of blood vessels underneath the relatively thin mucosa, and there is no bone present, or bone is far away. The point at which it becomes tightly attached to the bone is the beginning of the gingiva. This portion is the tightly attached part. This is known as the mucogingival junction. This is the mucosa and this is the gingiva. So this demarcation makes the mucogingival junction. The normal color of the gingiva is pink because the mucosal layer is thicker, and therefore the blood vessels do not impart as much color. In patients with darker skin color, generally some pigmentation to the gingiva is evident. Then pulling outward on the lip or corner of the mouth shows several areas where the tissue is attached in folds to the alveolar mucosa. At the midline in both the upper and lower lips, a fold of connective tissue known as the labial frenum can be seen. The labial frenum is seen. The frenum contains no muscle tissues, only connective tissue. The upper frenum is usually more pronounced than the lower one. The attachment of the upper maxillary frenum may extend to the crest of the alveolar ridge. The crest of the alveolar ridge. This is the alveolar ridge, and this is the crest of the alveolar ridge. It starts from the upper lip towards the crest of the alveolar ridge. And this band of tissue is so firm that the erupting central incisor might not penetrate it, but may be pushed slightly aside so that a space exists between them. This space is known as the diastema, or the space between the two teeth, because of the frenum. Correction of the diastema usually involves surgical removal or cutting of the frenum between the teeth. After this, the teeth will generally move together into normal contact. If they do not come back into normal contact, minor orthodontic treatment may be required. And this procedure is best done when a child is 6 to 12 years old. Now, coming to words, another big topic is the exostosis, also called the osteoma. Osteo mean bone. Osteoma, exostosis, is a benign growth of new bone. We have two types of growth, benign and cancerous. Benign growth of new bone on top of existing bone. Benign we will be explaining in further chapters. It can occur in many parts of the body. When the exostosis is covered with cartilage, it's called an osteochondroma. Exostosis can be painless, or it can cause several pain and require surgical removal. You can see it in the diagrams. This is the buccal exostosis, image of exostosis. This is exostosis and tori or torus, and it is in the maxillary part. So it is exostosis of the maxilla. Oral maxillary exostosis, you can see two bulging areas. Okay, exostosis of the mouth. The types and causes. Tori and exostosis are identified by their location in the mouth. Torus palatinus and Torus mandibularis are the two most common type of these bony outgrowth. Torus palatinus is a diffuse nodular growth found in the midline of the hard palate or roof of the mouth. Torus mandibularis growths are found in the lingual area of the floor of the mouth adjacent to the canine and premolar teeth. They are two in number. Less common are buccal exostosis that are found in the cheek side of the jaws, usually near the premolar and molar areas. With the exception of Torus palatinus, these growths usually present bilaterally, meaning they occur on both sides of the mouth. Clinically, when palpated, they all feel like hard bony mass covered by tissue or mucosa. What causes exostosis? Common causes include injury, chronic irritation of a bone, or a family history of exostosis. In some cases, the cause of exostosis is unknown, and it is related to family history, and this is called hereditary multiple exostosis or diphyseal eclasis. Tori are excess bone that develop either in the upper or lower jaw. When the present is in the floor of the mouth or the roof of the mouth, it is called palate. The condition is referred to as the torus palatinus. When it is present in the lower jaw or the floor of the mouth, it is called the torus mandibularis. Torus palatinus is a bony prominence at the middle of the hard palate. The size varies from barely discernible to very large, from flat to lobular. Torus mandibularis is a bony growth in the mandible along with the surface nearest to the tongue. Mandibular tori are usually present near the premolar and above the location of the mylohyoid muscle attachment of the mandible. What causes torus mandibularis? Again, is a bony sublingual protuberance, typically near canine and premolar. The etiology or the cause of tori is unclear. Possible causes include masticatory hyperfunction, continued bone growth, or genetic factors and environmental factors such as diet. Thank you. That's all. Oral mucosa is another concern or important topic. We'll be doing it later on. That's all for now. Thank you.